morning. I am Dr. Mark Woodall from Cascade Integrative Medicine, and my presentation today is why naturopathy or naturopathic medicine, and why Dr. Mark Woodall. So we used to have this model that provided a lot of usefulness to us. That was, if there was an infection, we'd provide an antibiotic and we'd cure that infection. It was a really simple model, and for a really, really long time, it was a really good model. And what I'm going to suggest to you is that's not a really good model anymore in today's world, okay? Because the patient that walks in to see me has infection A, they have pesticide B, heavy metal C, circadian dysregulation, poor food quality, and some kind of mental emotional trauma, divorce, physical and emotional abuse. And that is a melting pot that needs to be sifted out like cutting through layers of an onion to understand where this person is in most need of support. And that is where I feel like I shine. Because when we're walking through the forest and woods and we're trying to get home, we go through a lot of different hurdles and obstacles, and people have a lot of symptoms. They're fatigued, they don't have good sleep, they have anxiety, they have depression, their gut's not working right, their bowels aren't working right. All of these things are the common kind of picture that someone who comes to see me is presented with. So they just feel exhausted. They don't feel like they're digesting their food well. They can't think clearly. Their mood is not where it used to be or where they would like it to be. And they would like something to change, but they've been to a different practitioner, and sometimes it's a naturopath, sometimes it's a DO, an MD, a DC. It doesn't really matter. They've probably seen a couple of people, and they've tried a few things along the way before they get to me. So we're one, but we're not the same. And what this means to me is that we're all human. We all have livers and stomachs and brains and hearts and all of these things, but we have a lot of differences that we also need to account for. Some people can detoxify toxic mold better than others. Some people aren't exposed and didn't grow up on a farm with pesticides and different things that someone who grew up in New York City was exposed to. So our life experiences all coalesce and converge into the melting pot of our physiology. So I'm going to present to you 4 cases of 4 commonly run tests that I run that you might not have heard of or thought about in patients. And this is just a way that I like to think about things a little bit deeper. So this is a patient who I'm going to call Jenny in this case. And Jenny had already eliminated gluten and dairy and some of the common food allergies. She has Hashimoto's thyroiditis, but she also has a form of GERD that we call LPR. So this is what we call silent GERD, where people's voice is hoarse, and they've got a couple of other symptoms. And we did a food allergy test with her, and I kind of become dogmatic about the lab that I run these through now. It's a more expensive lab, but the results are higher quality in the technology that they use. And corn was actually one of the #1 triggers for her. We removed corn, and lo and behold, her LPR went away, and that was fantastic. Not every case that I'm going to present to you is a home run here today. It's to show you how complex people are. And so I'm not going to present just my best cases. I'm going to present cases like this one. This is a guy called David, and David is a construction manager. And a guy who I was like, man, this guy is toxic. Like, I don't know why or where he's being exposed, but he's a construction manager. Like, he's being exposed to a lot of things. And so we ran a urine test, and I get the results back the day he comes in to see me, and I'm flipping through the first couple pages, and there's like nothing. Like, there's nothing on here. I'm like, oh God. And then I get to the last page, and there's this compound called 1,3-butadiene, and this is an odorless gas that is released from rubber and all kinds of rubbers. And when they make rubbers and things like that, it's in playgrounds, if the playgrounds are made from rubbers. And that can cause lots of allergic-like symptoms, where we have runny, watery eyes, runny nose, all kinds of crazy stuff. And so this guy has a little bit of allergies, but he says, I have allergies 12 months a year. Those aren't standard allergies. Those are different types of symptoms, but they present an allergic presentation. This is a guy I haven't figured out where he's being exposed. He has no clue. He says, I don't really hang around rubbers, and we're trying to detoxify this, but preventing exposure is the #1 treatment plan to try to figure out how to heal this person. This is Jess, and Jess was a woman who lives in Seattle. She came to see me because it took her 2 hours to get to work driving on the buses in King County. She'd have to get off the bus multiple times because she had diarrhea, constant diarrhea. She had about 21 stools a day. And we ran a SIBO breath test, which is a test that most people are not running, to assess that she had bacterial overgrowth in her gut, and we were to treat this. And she only has 1 or 2 bowel movements a day now, and it's awesome. So that was a home run. We talk about poop a lot in naturopathic medications, and this person has vitiligo, which is an autoimmune skin condition, and I would have never have thought to run his heavy metals on his blood. Blood is his acute exposure. It's not what's stored in his body. And this kid's mercury was off the charts. That reference range of less than 11 is actually wrong. It should be less than 4, according to the CDC data. And so he has 6 times the amount of mercury in his blood than he should. So these are the ways that I like to think about going deeper than just because 16 labs, your standard blood work doesn't say anything's wrong, doesn't mean something's not wrong. You know something's wrong, you just got to find it. And that's what my dream and my job is. Dr. Mark Woodall, Cascade Integrated Medicine.